out by telling you my strengths and weaknesses and what I'm going to improve on this speech. My strengths were eye contact and my voice, but my weaknesses was making my speech more centered towards the audience. And I did say a couple times, and my overall was I was fidgety and stuff when I watched my video, so I'm going to try to stay calm, make it more centered towards you guys, and hopefully give a good speech. So, according to CBSNews.com, 30% of Americans take 5 or more pills all at the same time. And according to my audience analysis, 90% of my classmates have taken at least 1 pill. And also, according to greenchange.org, half of Americans take antipsychotics, pain relievers, stimulants, and other various drugs just to live a normal life. The purpose of this presentation is to inform you about how Americans need pharmaceuticals, and when I'm done, you will have a better understanding how pharmaceutical companies use this need to generate sky-high profit. To begin with, drugs help millions of Americans do normal daily activities and help them function as a normal person in society. And some Americans, to function properly, are willing to pay an exorbitant amount of money just to get these drugs because they so heavily depend on it. So, many people are overprescribed when many drugs are addictive and dangerous. In some cases, the prescription drug does more harmful effects than the good that it was intended to do. In one specific example, according to CBSNews.com, Beth Hollister was prescribed Augmentin for her ear infection. She was later sent to the emergency room because she was experiencing liver failure. And also, in my audience analysis, some classmates have also had problems with the side effects of drugs like depression and just having poor hygiene and maybe just being lethargic in general. So, according to the Journal of American Medical Association, an estimate of 700,000 people are sent to the emergency room due to adverse drug effects. And also, according to CBSNews.com, 1 out of 3 elderly patients are sent to the emergency room due to 3 drugs: insulin, digoxin, and Coumadin. And these drugs are very strong drugs, and when they aren't properly watched over, when the doctor prescribes their patients these drugs, there's bad effects. Hence why 1/3 of all elderly patients at the age of 65 and over are sent to the emergency room. So, OxyContin, Vicodin, Xanax, Valium, Adderall, Ritalin are the most common drugs that Americans are addicted to. 20% of Americans have admitted to taking drugs for non-medical reasons. And also, according to my audience analysis, 40% of the class has taken drugs for non-medical reasons. And the antipsychotic drug Risperdal is given to children. And one of the dangerous side effects of Risperdal is that it makes you eat incessantly. What that means is that it blocks the part of your brain telling you that you're full and you just feel hungry and you keep on eating. The negative effects from this is that some children have gained up to 100 pounds, and it's really bad. But also, the pharmaceutical companies have fast food companies invest in them, so that might lead to some questions of ethics there. So many drugs have dangerous side effects, and it is the doctor's job to prescribe the right drugs and amount of dosage for these drugs. Physicians can illegally prescribe a patient a drug even though not knowing what the side effects would be with other drugs. And so they can legally prescribe anyone anything. And also, doctors are paid tens of billions of dollars, according to greenchange.org, from pharmaceutical companies to help advertise their products to you and me. And here's a quote from greenchange.org. "Its extensive ties to physicians, especially physicians at prestigious schools, change the way research is done what constitutes a disease and the way medicine is practiced. Physicians receive many incentives from pharmaceutical companies, and in return, the pharmaceutical companies make an outrageous amount of profit. So for a drug to enter the market, drugs first need to be tested on patients. What pharmaceutical companies do to hide the negative effects of their drugs is to post the positive results over and over while conveying the negative results in a somewhat positive way to trick people into believing it's good for them. Also, they make up diseases that fit their drugs. So, for example, normal shyness is called social anxiety disorder. Heartburn is called gastro-reflux disease. And what they do by making these drugs, they create an artificial demand to increase their target market and then, in the end, increase their profit. And for social anxiety disorder, it's normal for someone to be shy in a room full of strangers. And it's not good to go and just go talk to strangers. It's a human nature to be somewhat suspicious of people. Okay, so now that you have a basic understanding of the way doctors receive, now they have an understanding of the effects drugs can have on you, the amount of money doctors receive from pharmaceutical companies, and the amount of money the pharmaceutical companies themselves are making from their business practices. You'll have a better understanding in the future when you're dealing with your doctor, and if he may prescribe you something that you believe you don't need. Millions of Americans rely on drugs to perform in just to do their normal daily activities. Many doctors use drugs when safer alternatives are available to their patients, like therapy. The reason you should remember my speech is because drugs aren't a panacea to our problems, and there are healthier ways to heal yourself.